The patient, basically, this muscle skeleton assessments are normal. Tested for the patient neck range of motion, the flexion by having the patient touches the chin to the chest is normal, is approximately 45 degrees. Extension by having the patient moving the head towards the ceiling is also normal in expected range of motion. The lateral bending with having the patient touches the shoulder with the towards the ears are also normal. The rotation by having the patient turn the head side to side is also normal. Tested the patient's shoulder range of motion by having the patient lying down, putting the hands up to the shoulder are normal. The patient is able to perform this with no trouble and no pain. And the extension part, having the patient put the hands behind the back, and it's also normal. The abduction by having the patient cross arm in between the bodies, that is also normal as well. Patient can perform that without any difficulties. And then by having the patient tested the elbow range of motion, by having the patient with a flexion and extension, by having the patient bend and straighten her arms, that is also normal. Patient able to perform that bilaterally. Supination and pronation are also expected in range of motion, by having the patient turn her palms up and down. Um, by having the patient twisting the wrist, tested that patient is also normal. By having the patient having the palm wave up and down and then sliding back and forth, front and back and left and right. So the flexion, extension, ulnar deviation, radial deviation, they're all normal bilaterally. No reduced ulnar deviation are found. Tested for the patient's spine range of motion in standing position. Patient is able to bend as far as she can, is about 30 degrees, and the extension is normal. The flexion, bending down over, trying to touch her toes, she did a good job, almost meeting towards like 90 degrees. Patient can also turn side to side. The rotation, patient is able to perform. Patient laying on in bed, with on her back. Patient's hips are fine. Patient is able to lift her leg toward the ceiling, so the flexion is normal. The extension by having the patient laying on her stomach, by having the patient leg having the patient's leg move towards the ceiling are also normal. Um, with the abduction, patient tested patient's knee range of motion. The flexion is normal, having the patient raise each knee up to the chest and having the patient sitting up side to side at the side of the table, having the patient strain up her legs are also normal. Like an L shape, patient is also able to perform that. Having the patient tested the angle range of motion, eversion and inversion, by having the patient rotating the angle towards me like in circle, that is also normal, so no reduced inversion and exversion. The dorsal flexion and plantar flexion are also in expected range of motion. Patient is able to perform having the palm up and down to the ceiling and down to the floor with no difficulty. By testing the patient's neck strength, patient is able to have a 5/5, which means it has an active movement against full resistance without any fatigue or pain. There's no muscle contraction. Patient are able to move move smoothly on with the joints over there. Patient can also test it for patient shoulder strength. Patients can snug up shoulder against the resistance 5/5, meaning it's active movement against full resistance without fatigue. That is normal sign. And tested for patient's elbow strength, which is pulling the forearm and push down the forearm. patients able to perform active movement against the full assistant. 5 over 5, both of them. Tested for the strength of the wrist. Patient is able to twist up the ceiling and twist down the ceiling. So it's also 5 over 5. Having the patient squeezing my hand bilaterally squeeze are equal with full resistant, 5 over 5 as well. No pain is reported, and then patient tested hip strength by pushing the thigh up the ceiling and ask the patient to push down and push up and push down. So that's also 5 over 5. Tested for the patient's knee strength by pushing the shin and tested for the knee resistant and pushing down the calf, having the patient push down towards the against the resistant. Also, that is 5 over 5 bilaterally, and tested for ankle strength by having the patient perform a gesture like pushing the gas pedal, and patient can perform that as well. And then push it down under the palm and on top of the patient's foot, and patient's able to resist that as well. That is also 5 over 5.